Our Dr. Tara Narula is a cardiologist at Northwell Health in New York, and she joins us once again. Tara, I know you have a lot to discuss, but before you do, I just want to talk about your piece yesterday because I honestly can't stop thinking about it. Yeah. We all felt some kind of way when you hear a doctor say, I'm scared, I'm worried, I'm afraid. You just don't hear doctors speak this way.
And that's really why we wanted to tell this story. You know, we never open up as doctors about our own vulnerabilities. We run into the room, we take care of people when they're dying, when they're bleeding, when they're in pain, and we comfort them. But we're human too. And so it was very important to show that side. And doctors are scared, and they're really scared because they feel like they're going to not only be infected themselves, but more importantly, the risk of infecting their family. And they feel like they're having to make a choice that no one should have to make, which is a choice between a profession that you took an oath for to heal and protect and serve others and your family. And what do you do when you're in that position? So, you know, the feedback we got from the piece yesterday was just all these, you know, healthcare professionals saying, I was crying, you know, for the first time.
I felt that too.
And we're not even near the peak here of what we're expecting to be up against. I mean, when you look at the numbers at other countries, Tara, what do we potentially face here?
Well, it depends. It depends how good we socially distance and how good we follow all the public health measures we're talking about. So certainly we have seen a plateau, a decrease in the numbers from China and South Korea. That's encouraging. It tells us that if you follow these measures, now granted theirs were aggressive and they had more testing, you can slow it. And that's why it's really important for Americans to understand that this term of flattening the curve and social distancing, it's powerful.
Those aren't just empty words. They mean something.
They mean something. They mean protecting our vulnerable. They mean decreasing the impact on the healthcare system. One of the things that's very important for people to understand is what is going on in Italy. Those doctors talk about a difficult decision. They're having to make decisions like in wartime about triage, meaning I can't save you, I won't save you because you're older and you're sicker and you're not going to survive. Imagine being put in that position. And that's what we could face here.
Yeah, the benefit of care calculation, if it's an older person taking the bed or a younger person, we really hope that doesn't come here. We've got the Navy sending 2 ships, the Army setting up field hospitals. But I'm interested in telemedicine, remote medicine as a solution for doctors. It would reduce their physical risk. Is that really a stand-in?
It is. I mean, it's kind of the perfect thing for a pandemic. We're doing that in my hospital system. We're, you know, condensing the number of visits, and we're using telemedicine. So it can never replace that in-person visit, right? But it can go a long way. And so I think right now, in the situation we're in, it's really a great tool for us. And I think it's going to allow the field to really grow and expand.
We heard about the self-swab test yesterday. The president mentioned that. What do you think about that? Do we know enough to self-swab ourselves, to self-test?
So just yesterday, there's a company that announced it will be releasing and producing a self-swab test this month. I think it's a good idea in the sense that we can use it more widely. It's, again, safer in the sense that you're not having somebody come into the office and expose themselves. Doctors and healthcare professionals are not exposed. There's some experience with self-swab.
But we're self-swabbing our nose, right? How do we know to do that?
Nose, well, it's relative. It's not going to be like the kind you see that's very aggressive.
You know, is it a reliable test?
Well, that's what we really need to figure out, right? And that will give us more of a sense of the, you know, how widespread this is. And one other thing that's in the works is also these antibody or blood tests. Those are really going to look at who has had the infection at some point, and that will give us the best picture of how the virus is spreading and what the true mortality rate is.
All right, Tara Narula, thank you so much.
Thank you.